How does genetic testing help in MDS diagnosis?
Excellent question. So we often use genetic tests to try to understand if a person has MDS in the first place. We know that myelodysplastic syndromes are driven by the acquisition of genetic mutations over a patient's lifetime. So the presence or absence of mutations can be very informative and can help us understand whether the disease that we're considering is truly MDS or whether it might be something else that mimics MDS. So for example, a patient that comes to my clinic who has low blood counts that I suspect might have MDS will undergo a diagnostic evaluation that typically includes some form of genetic testing. If on our genetic tests, we look at a large number of genes that are typically implicated in MDS and find that there are no mutations, it reduces the likelihood that the disease that the patient has is truly MDS. However, if we do find mutations that are typical of MDS, especially if we find multiple mutations, we can be more confident the patient has a diagnosis of MDS. And importantly, certain genes are very highly specific for the diagnosis. There are certain types of patients who have, for example, what we call MDS with ring sideroblasts. And these patients often will have a mutation in a particular gene called SF3B1. If we find that constellation, a mutation in SF3B1, in the presence of ring sideroblasts, we can be very confident that we have the right diagnosis. And importantly, the mutations will then help us understand not only does the patient have MDS, but what kind of MDS do they have and what is it likely to do in the future.